Hi, this is Randy Wykoff, the Dean of Public Health at East Tennessee State University, and this is your bare bones approach to better health. While we live in a relatively safe part of the country, if there's one take-home lesson from the recent hurricane, it's that everyone, everywhere is subject to an unexpected disaster. And while this one is so fresh in our minds, let's do what we can to reduce the risks of the next one. To that end, every home should have these 10 items. 1. At least a 3 to 5 day supply of water and non-perishable ready-to-eat food, including food for your pets. 2. A flashlight and several sets of extra batteries. 3. A basic first aid kit. 4. A 3 to 5 day supply of any essential medications. 5. A cell phone with a portable charger and a list of essential phone numbers. 6. Hygiene supplies like soap and sanitary wipes. 7. Extra cash. 8. A dry bag with a change of clothes relevant to the weather. 9. A sleeping bag or blanket. And 10. A list of critical personal information like passports, home deeds, bank information, and so on. The body of evidence includes several additional items you should consider. And while you can buy a prepackaged kit, it's easy and important to put your own together. Do it now while you really understand its importance. For more information on this topic, please go to the College of Public Health website. And until next week, please be well.